Bismillahirrahmanirrahim, my dear students. Today we will discuss an important topic that is named as endometriosis. Endometriosis. It is the presence of endometrial tissue outside the uterus. What do we mean by this? That when we find endometrial glands and endometrial stroma, endometrial glands or endometrial stroma outside the uterus. Outside the uterus means that the normal place of endometrium is within the uterus. It is found in the innermost layer of the uterus. But when we find this endometriotic tissue outside the uterus, you will say that it is the case of endometriosis. Most commonly, it consists of both endometrial glands and stroma, that we find glands along with stroma outside the uterus, but in some cases you may find only endometrial stroma without endometrial glands, or you may find only endometrial glands without endometrial stroma outside the uterus. In all these cases, you will label such condition as endometriosis. It occurs in the following order. In the ovaries, in the uterine ligaments, in the rectovaginal septum, cul-de-sac, pelvic peritoneum, in large and small bowel, in appendix. You may find it in mucosa of the cervix, in vagina, fallopian tube, and in the laparotomy scars. So my dear students, these are all the sites where you may find the features of endometriosis. Endometriosis is an important clinical condition. Why? Because it causes infertility, it causes dysmenorrhea, that is painful menstruation, it leads to pelvic pain and many other problems. So this disorder is principally a disease of women in active reproductive life, that is most often in the 3rd and 4th decades, affecting approximately 10% of endometriosis. Uncommonly, it can show features that we say metastasis and invasion, that is similar to malignant tumors. When these features are present, they often contribute to significant complications. Examples include the invasion of the muscular wall of the bowel. It can result in intestinal symptoms. See, these are the pictures in which, this is the first picture A, in which you find that this is intestinal mucosa, but here within the intestine you find the endometriotic glands. These are endometrial glands and endometrial stroma. Here magnified view, endometrial glands and endometrial stroma, that is seen within the intestine. So this is the picture of endometriosis. Two major theories for the development of endometriosis have been proposed. Number one is the metastatic theory and the other one is metaplastic theory. The metastatic theory, it says that endometrial tissue is implanted at abnormal location, that this tissue may be implanted. How? The retrograde menstruation through the fallopian tube, it occurs regularly even in the normal women, and it could mediate the spread of endometrial tissue to the peritoneal cavity. So this is one theory regarding endometriosis, and this is named as metastatic theory. Endometriosis is also found in the cervical mucosa, particularly following the surgical procedures, and it supports the implantation from the above theory. In addition, this theory can explain the spread of endometriosis to distant sites via hematogenous or lymphatic spread. So, in the context of endometriosis, the term metastatic, it simply refers to the appearance of endometrial tissue in the extrauterine locations but does not imply an underlying mechanism. This is the metaplastic theory. The endometrium could arise directly from coelomic epithelium, that is the mesothelium of pelvis or abdomen, from which the Mullerian ducts and ultimately the endometrium itself originate during embryonic development. So this is the metaplastic theory. Some of the specific abnormalities that distinguish normal endometrium from endometriotic tissue are that there is a profound activation of the inflammatory cascade in the endometriosis, and it is characterized by high levels of prostaglandin E2, interleukin 1 beta, tumor necrotic factor, and interleukin 6. So the key role played by prostaglandins in endometriosis is supported by the beneficial effects of COX-2 inhibitors on pain. That is an important clinical feature of this disorder. Estrogen production by endometriotic stromal cells is markedly upregulated due to high levels of the key steroidogenic enzyme AROMATASE. This enzyme, AROMATASE, is absent in normal endometrial stroma. The estrogen, it enhances the survival and persistence of endometriotic tissue. So there is linkage between activation of inflammation and estrogen production that suggests by the ability of prostaglandin E2 to stimulate the local synthesis of estrogen. So, it is suggested that there is a link between the activation of inflammation and estrogen production with the due to the ability of prostaglandin E2 to stimulate the synthesis of estrogen.